Hello and welcome to the tip of the day. I'm Dr. Amy Starr with the Mesa Veterinary Clinic, Paws and Hooves Mole Veterinary Services, and San Francisco Stables, and we're helping El Paso help their pets. So today I want to talk about canine infectious disease complex. We had a client or someone on Facebook ask us to cover this, as it was another article in attached to one of the articles that we had posted, and so I just basically wanted to go over it and what it entails. And so we used to call the upper respiratory coughing kennel cough, and in our clinic we've stopped calling it kennel cough for the most part a while ago, because when people think of the kennel cough vaccine, they think that it's only for kennel cough and it's only in dogs that are being kenneled or going to groomers. And over the past couple of years, we've seen quote-unquote kennel cough symptoms in many patients that have never been kenneled or haven't even left their backyard. And so it really is a disease complex, meaning that there's several different factors that come into the symptoms. And so first of all, true quote-unquote kennel cough is made up of two different infectious agents. One is parainfluenza virus, and the other is the Bordetella bronchoseptica bacteria. And so it is a complex because it's made up of both viruses and bacteria, and that is the reason why we can treat part of it, but the other part we just have to support the body and let it fight it off itself, just like us with a common cold or a flu. We don't want to shoot antibiotics at everything if there's not an actual bacteria component of it. So basically with the kennel cough, we do a lot of supportive care, make sure that they're getting enough fluids, make sure that their attitudes are staying good. We give them cough suppressants, we give them anti-inflammatories to help soothe the throat when they're coughing. And we do give an antibiotic that treats the bacterial side of it. But again, there's nothing that we can do to treat the viral side, which is the parainfluenza. Parainfluenza is in most of the distemper parvo complex vaccines, and so vaccines can be purchased in any different way. They can be purchased with just distemper, just parvo, just both of those, or with other components. At our clinic, we purchase it where it has several components in it. So it has the distemper, it has the parvo, it has the parainfluenza, it has the adenovirus, which covers hepatitis. And so there's actually more that you're getting than just the distemper and the parvo. But for ease sake, and because most people just know those two, we just name it distemper parvo. But it does have the parainfluenza, which helps to prevent against that side of the kennel cough quote-unquote disease, the upper respiratory disease. The other one is the Bordetella vaccine, which actually covers for the bacterial side of it. And then obviously there are other things. Now we've got the flu that is potentially coming, at some point will come to El Paso, and so we've got a vaccine for the flu. And then there's other just little irritations and infections. And when we do have a patient with an upper respiratory disease, we do always recommend doing what we call an upper respiratory panel, which basically is taking swabs. So similar to you, if you go to the doctor and you get a swab for strep throat or for flu, this is a swab, and it actually tests for distemper and the Bordetella and parainfluenza and other bacteria that we can find and see if that is a problem or not. So the complex, like I said, is something that just means that there's several different things that goes into what we used to call kennel cough. So if you have any further questions, let us know. We're more than happy to talk to you about it, and we hope you have a great day. Bye-bye.